All right, impingement syndrome. So with this supraspinatus tendinitis or rotator cuff degeneration, is there physical damage to the tissue? Yes. So is it going to hurt if their arm is down? Is it going to hurt if their arm is up? Yeah, it can still hurt because there's damage to the tissue. They're feeling the pain because there's either inflammation to the tendon or degeneration of the rotator cuff. Impingement syndrome is basically when that arm is in a position where you're compromising that space, then they're going to feel the irritation. So that's going to be something that when their arm is in such a position where they're narrowing that space right there, so it's going to be with elevation of the arm, especially with internal rotation. So at that point, while those structures are pinched, they're going to feel the irritation. Okay, but then you drop the arm back down, there's no damage to the tissue right there unless it occurs over a repetitive time. So they're going to have, there is going to be some inflammation there, but they're going to tend to have the symptoms more only when they are in that position. Okay, if it starts out that way, let's say they did a bunch of throwing and it's irritated, but it's a mild case and it's an early stage, so they're only really going to feel it when they're in that compromised position. When their arm is down, they may not have a problem unless there's more severe damage to the tissue. Remember I was saying it's like a spectrum. You can start out with just a little bit of inflammation or irritation of the tendon that's mild, and then over years and years and years it can progress more where you start getting degeneration of the tissue, fibrosis and fraying away of the tissue. But if you do this impingement long enough, then you are going to start to get some tissue damage. But it can start out to the point where it's just irritation when they're in that compromised position. So here, like I said, you have that, what's this right here? Chromium. And then this is the coracoid, so that's the coracoacromial ligament. That's what we call like the roof of the shoulder joint. And so then here's that subacromial space, and then you have that bursa, subacromial bursa, and then you have the supraspinatus tendon. So all those things are going to get irritated when it's up in that position right here. And since the greater tuberosity is more on the lateral side, when you internally rotate, that compromises that space even more. All right, so here's the greater tuberosity, here's the lesser tuberosity. So if we go like this, and then we add internal rotation, that jams that up in there even more. Okay? So you're going to get tenderness of those structures here. Okay? And then the tests that we're going to do are things that involve restricting that space. So we'll have different types of impingement syndrome tests, where one's up like this, another one going in like that. So we're not just doing something where we're testing the contractile tissue like a resistive test, we're putting that joint in such a position where we're compromising that space and irritating those tissues. All right, so now we're talking about biceps tendonitis, and it's specifically right here where it goes through this groove, and then also it's attaching to the superior part of the glenoid fossa. Okay, so this is the long head of the bicep. So you can, again, it's one of those structures that with throwing repetitive sports like that, it can get irritated. You're going across like that biceps tendon is getting rubbed under that subacromial arch. And then another part of it is here where you have this transverse ligament. That ligament can get frayed, and then that tendon can pop in and out of that groove. So here's where the tendon is right here. That ligament goes across it. If that ligament's torn or lax, or sometimes if you have a congenitally shallow groove there, that tendon's going to snap across the bone. If you do that enough times, it's going to get frayed and irritated. And so then the body responds to that irritation by you can get fibrosis and thickening of the tendon. So biceps tendonitis, repetitive overhead throwing. Again, it's one of those common mechanism of injuries, like I said, a lot of these things have the same causative mechanism of injuries, doing the same thing, but they can result in different tissues being affected, whether it's more of the supraspinatus, more of the biceps tendon, depending on the particulars of that person. And then with biceps tendonitis, again, it's a contractile tissue test, so we're going to be doing something that's going to involve contracting the muscle. So you have a speeds test where basically you're doing something like this, where you're contracting that biceps muscle, and we're looking for a reproduction of symptoms of pain. All right, now you can, with repetitive trauma, again, this is the situation where that long head is dislocating, so it's popping out of that groove. So you can just have biceps tendonitis from repetitive throwing, or you can have dislocation where that biceps tendon is being affected right at the bicipital groove. So in that case, what they're going to do is they're going to describe maybe that there's some popping in that joint, because that tendon's popping in and out. And so then there's moving into internal external rotation, and then also contracting the biceps muscle at the same time. And then they could have some tenderness right over that spot. And then the special test we're going to do is, this is contractile tissue, so it's going to involve some type of contraction where you're going to have the patient try to pull out like that, and you're reproducing that biceps tendon sliding in that groove. There is another condition that's not in the notes, so we won't really be testing on it, but has anybody heard about frozen shoulder? Okay. It's also called adhesive capsulitis. What happens is frozen shoulder, it kind of goes through a process where it's freezing, it's frozen, and it's thawing out. So it can happen over a period of many months or even a year or so, is that when you have a freezing shoulder, is that it's starting to get reduced range of motion. So if someone's having pain in their shoulder, they don't move their shoulder. The less they move it, the more it starts to freeze up. So they go through the initial part where it's freezing. So it's starting to stiffen up. And then you have frozen shoulder. Okay? So then they're not moving their shoulder. It takes a lot of, it's a difficult type of thing when they're doing different physical therapy to try to restore that motion. And then they get to the point where the motion starts to be reintroduced into the shoulder. And that's almost what you would call thawing shoulder, right? Just like if something's frozen, it's starting to thaw out, starting to move again. Right? You may see that tends to happen in elderly people, the joints that are getting stiff. So you may see that, and that's just another thing but we're not really going to get into it, although it's something that occurs so much that it should be mentioned, because some of those frozen shoulder is more common than some of these things. Like you may not see labrum tears or something like that, but you have a better chance of probably seeing frozen shoulder in the clinics.
I just have a question about that. Is it often just because things are just too tight there?
Because of what?
They're just like everything's too tight. They just need to almost stretch it out. Is it that simple or?
Yeah, I mean, frozen shoulder can happen from, let's say they have a shoulder injury, and then they don't move the shoulder as much, so it tends to start. It's called adhesive capsulitis. So the capsule of the joint gets irritated, and then it can get inflamed and eventually start to get fibrosed. Okay? So she's asking if it happens because the shoulder's too tight. The tightness develops. It doesn't start out that way. It's not that because the shoulder's already restricted range of motion, then you get frozen shoulder. It's that something happens for whatever reason, and the capsule gets irritated and inflamed. You start to get adhesions, and it just freezes up. So like I say, it goes through a process where it's starting to freeze, then it's frozen, and then it starts to thaw out. And that can happen over a long period of time.